Hi there, Annie Boheler here. So I am hopping on here today to share a bit of a message around psychedelics, diagnoses, and suggestibility with clients and trauma healing. This message is directed towards and also inspired by licensed professionals. So I'm in a year-long course with Psychedelics Today called Vital. And this is a psychedelic facilitators course. And it is the most comprehensive training I'm aware of to date. I've been following these trainings coming out the last few years, which mostly have been oriented around ketamine and cannabis because those are the legal substances. And going through the agenda, even going through interviews and signing up and getting the coursework for other trainings. So I'm not a licensed therapist. I am a licensed medical provider, but I'm not a licensed therapist. And in my private practice, I work as a coach and a somatic experiencing practitioner. I have largely built my private practice off of referrals from therapists because I'm a sex positive coach, SEP. So I do work at the intersection of trauma and sexuality, with pleasure being a foundational ingredient in healing trauma. So that, along with my 10 years plus experience around psychedelics, is culminating into my current practice and formalized training around psychedelics. So what I came on here to share today is something I think is very important for licensed therapists to be aware of or just think about from a perspective of a mental health practitioner who's not licensed. Because one of the reasons why I started doing this work was my own healing around surviving multiple people close to me committing suicide, as well as many psychedelic experiences and my own healing around sexual assault and interpersonal partner violence. So in this cohort that I am a part of for the Vital training, there are a lot of therapists and a lot of licensed counselors and mental health professionals who do not have experience with psychedelics, who are doing this training so that they can incorporate that into their practice. So I'm coming from a very different perspective, having a lot of underground experience for over a decade, as well as just the lack of, I don't have the academic education with a master's degree. I do not have a master's degree, and I reject pathologically based mental health frameworks. So that's pathology based or diagnoses based. Just has not attracted me. So that's one of the reasons why I don't have not pursued a master's degree yet. Maybe in the future I will. So it's very apparent to me the amount of unlearning that actually probably should happen before licensed folks go to incorporate new information. It's like there's got to be unlearning before the new information can come in, because psychedelics does not actually work with the medical model, although a lot of people are trying to make it. So, and it will, because when you have all the money for research, you can just force whatever you want. So I am speaking to that from like, my degree is in science, ecology, so I'm aware of how research happens, which is, yeah, a whole other conversation. But so I just think it's really important. This came up recently in my class, because there's so much fear from providers around like screening. How do we know if this is the right tool? How do we know if it's appropriate, if somebody does psychedelics or not, or comes for these services? With the Michael Pollan exposure, there's a lot of people thinking it's going to be this silver bullet because other treatments haven't worked. So there's a lot of it's very understandable why there's a lot of concern around how to screen properly to see if it's an appropriate tool for somebody. Totally understandable. Also, when the screening is fueled by fear, or there is fear at all, that is concerning, because when we enter a psychedelic state, or if somebody is not in a psychedelic state, but perhaps submitting to a professional for guidance in any way, they become more suggestible. The suggestibility goes up. So that's why boundaries and consent and all the ethics of caring are so much more important. Although they really shouldn't be. They should be just as important as if we weren't on psychedelics. But there's just an amplified energy there. Totally understandable. But this is kind of the core of what I'm getting at, is that while that's important, one, noting how much that susceptibility around fear is like impacts the client or potential client, as well as acknowledging that that suggestibility and that impact of an experience should also be highly considered when offering or giving somebody a diagnosis. When a professional licensed person gives somebody a diagnosis, there should be just as much concern around the impact of that diagnosis and how that may or may not affect somebody, as if you were giving somebody a substance or going into an altered state experience with them or facilitating. When a person is given a diagnosis from a licensed medical person, that impacts them. And for some people, that can be very clarifying, like, oh my gosh, I'm so glad I'm seen as having anxiety, because I do have anxiety, but I felt all alone, and now I can have some guidance and a clear path of healing. That can be something that happens. For some people, it can be extremely harmful and confusing, especially because traditional American psychotherapy is not based in trauma awareness, intergenerational trauma, because epigenetics is like brand new to the Western science world. Somatics, it's not body oriented. So there's all these ethical issues, in my opinion, around giving someone a diagnosis when there is not a proper foundation for care around how that diagnosis impacts someone. And I'm sharing this because the reason why I do the work I do, my personal friend who we lost was diagnosed with schizophrenia. We will never know, I don't think, if this person had schizophrenia. My understanding was that his family rejected him and there was trauma. So the therapist said, you're schizophrenic, when and this is just my opinion, this is my personal friend, likely, possibly this person just had some trauma and was not seen for who he was. And so to give someone a diagnosis of schizophrenia and then send them off into the world, that person may start to identify deeply with that diagnosis, and that could cause severe trauma, when really it was just trauma to begin with, and that's being overlooked in the form of a medical bypassing to prescribe a diagnosis. So I think it's pretty obvious at this point that the DSM-5 is just for insurance reasons, so you can diagnose someone and communicate with other practitioners about somebody. But I just think that it's extremely harmful to speak about it and to orient around it as a professional without really acknowledging how superficial it is. When you tell someone that they have a diagnosis based off of symptoms that are surface level, it's the manifestation of the issue. Their issue perhaps could be being deeply disconnected from nature, or having challenges with coping with an extractive, capitalistic, fascist social structure. I mean, the therapy academic programs traditionally are not radical. So there's more and more like liberation psychology programs available, which is super cool. But it's like just now starting to be a thing. So I really want to support other therapists and practitioners around this, and just please keep in mind that just because we have training, or just because we have education or letters behind our name, does not mean you know a person, know what's best for them, or can predict the impact of a specific process or a piece of a process of healing. So I hope that's helpful. I am opening my practice up to consultations with practitioners around psychedelics, sex positivity, and trauma, as well as the somatic foundation. So please keep that in mind. And I think it's just, I'm not trying to give any like direct advice or feedback necessarily, but just sharing this as a call to action, or like a perspective to consider, because I'm working as a mental health professional, kind of on the edges, like breaking taboos. And part of that has emanated into how I've educated myself. So I think that perspective is valid. And not only is it valid, it will be foundationally important as the medical Western perspective is integrated in with non-pathology based mental wellness, emotional wellness modalities such as psychedelics. So we're breaking the paradigm of pathology. There's no end or beginning to growth and healing. And that's why I think in Oregon, it's really cool how they're advocating for folks who, to be able to take psychedelics without a prescription, meaning you can also take them to feel good without a specific diagnosis. That's how we've evolved with the medicine. And there's a lot there. That doesn't get talked about with any program that's very Western or medically based, which a lot of them are for liability reasons. So I highly recommend the podcast, Psychedelics Today. The folks who started that podcast are the facilitators of this 12-month training I'm in. So check out Psychedelics Today. Please just be careful. There's just a lot shifting, and and I appreciate your consideration and time on this topic.